I'm Kristine Dawang, the Program Manager for AuRNPathway. In this video, we're going to demonstrate and explain basic life support using the Doctor's ABCD Mnemonics, tailored for nurses working in a clinical setting. Your quick and efficient response in emergencies is vital, and understanding these steps can make a significant difference in patient outcomes. Now let's walk you through the Doctor's ABCD steps. D is for danger. Ensure that the area is safe to yourself, the patient, and others. Check for any hazards that could pose a risk in the clinical environment. R is for response. Check for patient's responsiveness. Gently shake the patient's shoulder and ask loudly, "Can you hear me? Mrs. Butler, are you okay?" If there is no response, move to the next step. S is send for help. Call for an assistance immediately. Now, in a hospital setting or clinic setting, use the emergency call system to alert the rapid response team or the cold blue team and request for an automated external defibrillator. This is also the best time to get the ambu bag to get ready for 2 breaths. If it's connected to the oxygen, then turn it on to 10 to 15 liters per minute. A, check for airway. It's important to maintain a clear and open airway. Now for adult, make sure to remove the pillow, head tilt, chin lift, and look for any vomitus or any foreign material in the mouth. Now for pediatrics, infant and child, make sure the head is in neutral position and you can use the jaw thrust technique. Now if there's something in the person's mouth that shouldn't be there, the person has to be put in a recovery position and remove the foreign material using your fingers. B, check for breathing. Place your ear close to the person's mouth and the other hand on the patient's abdomen. Look for chest or abdominal movement. Feel for regular movement of chest or abdomen and listen for normal breath sounds. Now, if the person is breathing, then place them into the recovery position and monitor until the medical emergency team arrives and takes over. C is for cardiopulmonary resuscitation. CPR maintains oxygen-rich blood to our vital organs, your brain, heart, and lungs. It maintains the viability of the casualty until more advanced support arrives. To compress using the arms and the hands, for adults and older children, use 2 hands with 1 hand over the other or with fingers interlocked. Keep your arms straight, shoulders parallel over the hands. Make sure to use your body weight to push and make sure to keep an even rhythm. Now, for a child, 1 hand has to be used, and for an infant, make sure to use 2 fingers. Now, there are 4 things you need to remember while compressing is that the placement needs to be in the lower half of the sternum. The depth has to be 1/3, that's about 5 centimeter depth, 100 to 120 compressions per minute, about 1 to 2 compressions per second, and give the compression a full recoil, meaning you have to come back before you compress again. Now, without full recoil of the sternum after each compression, even with perfect follow-up compression, timing and depth, there is no blood in the heart to push out. Then give 2 breaths. If the patient is infant, it is more appropriate to give 2 breaths prior to compression as infants are prone to hypoxia. How much breath do we give? For an adult to raise the chest, you need to give the normal breathing strength. For a child, half a breath, and for infant, just a puff. E is for defibrillation using an automated external defibrillator or AED. Now, defibrillation is the use of an electrical current to help your heart return to a normal rhythm where a potentially fatal arrhythmia or abnormal rhythm is happening in the patient's heart's lower chambers or ventricles. Using a defibrillator is quick and easy to use. Make sure to know how to use them. And don't forget to hit that subscribe button below so you get notified whenever I upload informational video for you. Write a comment if you have any questions at all. Now, if you would like to learn more about OSCE in Australia, don't forget to visit our website at www.aurnpathway.com.au or email us at support@aurnpathway.com.au.